just barely scraping by. You know, we have some friends, you know, that were both working, had a child, had health insurance, both unemployed, both parents didn't have health insurance for a period. One of them's back to work, spending half of their income on health insurance. But, you know, they take a risk when they're without health insurance, and what I want to know is what would your proposal be to make health insurance more accessible to unemployed? I mean, everybody can get health insurance if they have the money to buy it, but, you know, the vast majority of people, when they're unemployed, they get half of their normal income, and they have this huge broker bill that they pay. And what I want to know is, in your health proposals, what would you do about the unemployed? Thank you.
My name is Jim Piles. I'm from Elkhart, Indiana. I am a 5-year naval veteran as a hospital foreman. I'm a retired pharmacist, so I know a little bit about this drug business. And I would just ask that, although you may have already made up your mind, I would like for you to consider 3 points before you take the final vote. If you do that for me, I'd appreciate it very much. Here we go. 3 points. Would you include a strong public auction as one of the things you'll consider? Second, would you include an employer mandate so there's insurance programs available for the employer to offer to his employees? And thirdly, I would like to make sure there are no taxes on any health care benefits that are received. And if you're wondering how we can pay for this, I'd say let's bring our boys back from Afghanistan and Iraq, and we can pay for it.
My name's Rod West. I'm from Warsaw. First of all, I'd like to say thank you, Mr. Congressman, for having this hearing tonight. I'd also like to thank all of our veterans for all the freedoms that we enjoy, especially the freedom of speech that we're exercising this evening. Out of respect for all of them, let's allow everyone to speak. Thank you, Mr. Congressman, for taking a position on the public option. Only cowards don't take positions. However, the positions we take demand actions here tonight. We must retain our integrity and stand by our word. Our country needs honest leadership. Our families need honest leadership. Many are against taxpayer-funded or government health care. Raise your hand if you are against taxpayer health care. Is there anybody here tonight? Congressman Souder, you have taxpayer-funded government health care. To retain your integrity, you have 3 choices. As does everyone here, we have 3 free choices. Number 1, you can revoke your taxpayer health coverage that I pay for. Number 2, you can resign your congressional seat. Number 3, you can support taxpayer-funded government health care and keep yours. You've been in office for 15 years, and for 15 years, by your silence on the subject, you have supported taxpayer health care for the convicted criminals, everyone in jail and in prison, murderers. You haven't spoken out once against their taxpayer health care, but today you speak out against taxpayer health care option for the victims. Health care that the taxpayer pays for themselves while you enjoy it. We thank our outstanding civil servants for their service, our police officers, our sheriffs, our school teachers, our congressmen and our congresswomen, federal, state, county, and city employees, the president, and the entire military. The citizens' tax dollars make it possible for all of these civil servants to exist and for their health care. It's time the taxpayer was recognized for their civil service of funding the government, including funding Medicare and the disabled. And that is right and that is good. It's time the taxpayer, the civil servant that is the taxpayer, is recognized more than just at election time. You hold on to your government supplemented Medicare, and Congressman, you hold on to your government health care like a security blanket. We, the taxpayers, don't want to take your blankets that we pay for. We just ask for you to share a corner of it, just a corner. If you won't share what we pay for, then everyone today can revoke their government health care for themselves and their family. And Congressman, you can revoke yours. Or you can resign and repay your medical expenses that I've paid for you and for your family. Or you can support taxpayer, government-funded health care and keep yours. The choices are simple, and the questions demand responses. Why do you support criminals' health care and not a choice for the victims? Do you revoke yours, resign, or keep your government health care?